Now, as the health reform debate plays out in the U.S., some Americans are finding new ways and new places to get medical care. Ray Suarez has the story.
South of the border, tourist season is just beginning. Beach-loving Americans are headed to Mexico's seaside towns, reaching for the sunscreen and soaking up the local color. But this year's annual migration has a twist. Thousands of Americans are coming to places like Puerto Vallarta not to dip their toes in the warm Pacific, sip a margarita, or browse a crafts fair. No, they're coming for health care, in many cases, care they could never afford to acquire in the United States.
Tell me how you feel today.
A lot better. Oh, yes. Wonderful. No
55-year-old Stan Packard flew to Puerto Vallarta to have his hip replaced.
It's going to take about 6 to 8 weeks before you can feel really comfortable with yourself. This only has been 2 weeks.
We caught up with him at the follow-up appointment with his Mexican orthopedic surgeon, Dr. Max Grieg.
Had you ever been to Mexico before?
Never. No, I just took a shot.
Pretty big step to take on your first trip to Mexico. You go fly down and come back with a new hip.
Well, something had to be done. So.
Packard and his wife own a horse park in California that specializes in carriage rides. Caring for all the horses is a physically demanding job, and one of Stan's hips just didn't hold up. For years it was causing him pain. But the Packards don't have health insurance.
When they told me I was for sure going to need a hip, then I knew I couldn't afford it in the States, so we started looking. In the States, they said it was $80,000 to $120,000.
Pretty soon you'll be able to walk around without your walker.
Just the cane.
Packard went on the internet and found a Texas-based company called Med2Go. It led him to Dr. Grieg's practice in Mexico, where Stan paid $13,000 for all travel and medical expenses.
Were you a little scared?
I've never been in a hospital, under surgery. I've never had a broken arm, nothing. So, but I knew the pain I was having before I got here was unbearable. I wanted it done more than I was scared.
All right, Stan. Yeah, but stay straight back there, okay?
Dr. Grieg operates on more aging baby boomers every year. They choose Mexico for joint replacement surgery, not just for the cost saving, but also for the comforts of a city like Puerto Vallarta that already caters to tourists.
We have a whole team that receives them at the airport. We make sure that they get accommodated in hotels and that they are transported from the hotels to their different appointments or to the hospital. And then after the surgery, once they're released from the hospital, we have nurses and physical therapists that visit them in their hotels. And this way they can recover in a beautiful place, looking at the swimming pool, looking at palm trees.
Grieg is a member of the American Academy of Orthopedic Surgeons and touts his state-of-the-art facilities.
We're using the same implants, same prostheses, same techniques, but here we have a great advantage. We don't have the liability costs as you can find in the U.S. I pay as an orthopedic surgeon about 1/10 of what my colleague in the U.S. will pay for malpractice insurance.
And with 1 million U.S. citizens now living in Mexico, many of them retirees, private hospitals now advertise American standard facilities. 10,000 Americans live in Puerto Vallarta. So many that local expats here are holding a series of town hall-style meetings about Medicare benefits.
We all know that Medicare won't cover your health care expenses when you're outside of the United States. And we have to ask, why not? And the fact is, there's no good answer to that question. Would it cost more to cover you in Mexico? No.
A group called Americans for Medicare in Mexico is lobbying Congress to amend Medicare rules to allow for health care coverage in Mexico, where medical costs are much lower.
It would cost the Medicare program about half as much to cover you here as it costs to cover you in the United States.
Former Senate staffer Paul Christ, now a Puerto Vallarta hotel owner, is leading the campaign.
I think it's a great deal for the taxpayer. I actually see this as a win-win-win-win. And I'll tell you why. First of all, it's a win for the retirees that live in Mexico and for the retirees that want to retire to Mexico. It's a win for Medicare because it saves money. It's a win for the Mexican economy because an influx of retirees will create jobs, good jobs in Mexico.
But with Americans already consumed by a debate over health care reform, the campaign may have a tough time getting attention in Washington. In the meantime, some retirees are taking advantage of the insurance offered by the Mexican government's social security system called IMSS or IMSS. For only $300 a year, Americans who can establish residency are offered an array of medical services with no deductible.
And get that angle.
Susan Witcherman retired to Puerto Vallarta 12 years ago and now teaches yoga here. She signed up for the Mexican Social Security health plan as a backup, but soon suffered an arm injury which required multiple surgeries.
All your specialists, I've seen traumatologists, I've seen gynecologists, I've seen psychiatrists, it's all paid for. Too good to be true.
But there are limitations to Mexico's government plan. Anyone with a pre-existing condition is excluded. The facilities are not cutting edge. And if you're not in need of urgent care, the lines are notoriously long.
It's always overloaded with patients. There's hundreds of people waiting on waiting lists. There's waiting lists for surgery for up to about 6 months. And so it's a system that you have to wait it out.
The Social Security program was originally set up for Mexican workers, but so far foreigners have been welcome. Just over 1,000 Americans in Puerto Vallarta alone are now enrolled. Dr. Eduardo Montero is director of the IMSS hospital in Puerto Vallarta.
The motto at IMSS is Social Security for all, and as far as the enrollment of foreigners, I don't see a problem.
Even so, some health officials here worry that uninsured Americans could quickly overload an already burdened system. But as far as foreigners coming to pay for services on their own, industry leaders are embracing that idea. There's even talk of building assisted living and nursing homes here so foreigners can capitalize on Mexico's cheaper labor market. Economic analysts say more than 1 million patients worldwide cross international borders annually for medical treatments, and places like Puerto Vallarta seem eager to host them.
In his second report tomorrow, Ray will examine how the Mexican government is trying to improve health care for its own poorest citizens.